Welcome back. Now, it's time for us to learn a little bit about orthopedics. There is a world-leading expert in that field who is running a center right here in Ghana, providing that very specialized area of health care. His center is called FOCOS Orthopaedics Hospital. Let's learn about how him and the people there are doing everything possible to treat spine defects. And of course, the center has an upcoming dinner to raise some funds. We'll tell you how you can join this noble cause. Check this out. We're somewhere in Accra, not particularly far from Pantang Hospital. Just to situate this conversation, we're at FOCOS Orthopaedic Hospital, the Foundation for Orthopedic and Complex Spine work. It has been in Ghana since 1997. Today we're honored to meet the man who brought it all to life, whose organization is now starting a new chapter in its life. And absolutely, we want to bring you along, Professor Ohinibabu Achieje, to be accurate. It's very nice to meet you. And Prof, your reputation precedes you, your work at Cornell University, which then led to you setting up this foundation here in Ghana, and the testimonies of those who have been here and benefited from the work you do. Perhaps I'll give you the chance to give us the origin story,
Sure.
Just very briefly. How did it all come to be?
Definitely, and thanks for giving me the time and coming to visit our wonderful facility. I was in the U.S. for a long time, 40 years basically, and I went there basically to study, get a good education, become a good doctor, and hopefully make some money and come back and put it to good use. So in 1998 is when I established the Foundation for Orthopedics and Complex Spine as a not-for-profit organization in the United States when I was a professor at Cornell. So with that mission, our mission was basically to bring orthopedic care to Ghana. So I organized teams twice, 3 times a year, and we had these medical missions from 98 to 2007.
Right.
During which time about 500 volunteers accompanied me to Ghana, and we operated on many patients. We saw a lot of patients from Ghana and elsewhere. We had a clinic at East Legon, which was the FOCOS clinic.
Yeah.
And then we decided that it's probably better if we can have a permanent infrastructure, i.e. a hospital. So that led to a huge fundraising campaign where we were able to raise enough funds to be able to build this hospital. But the whole goal is to bring orthopedic care to Ghana. There's a huge need for orthopedic services. Orthopedics is a specialty that deals with the muscle and bones and joints and ligaments and tendons and nerves. It's basically the things that make us move.
Yeah.
My hands would move, I will walk, I will jog, but 80% of people in the world are going to have back pain sometime in their life. And orthopedics, if you put it all together in terms of disability and death, is the number four leading cause of disability and death.
Wow.
Yeah. And only about 30% of the world's population have access to radiology services, and you cannot do orthopedics without radiology. You have to take an x-ray. So only 60% actually have no access to radiological services. So it's a specialty that also involves a lot of reconstructive work. It is not like other surgical services where you take out an appendix, you take out a thyroid. Here you're building bodies. You put in implants, you put in equipment. So it makes it expensive. And for that reason, it's very difficult for underdeveloped nations to provide a comprehensive, high-quality orthopedic service, such that an operation which will cost like $100,000 to fix one complex spine, here we could do it for like $10,000. But it's still a lot of money for many people. So going back to what I was saying, is that there's a huge need for the service in the country, 29 million people, and we have only 30 orthopedic consultants, which means 1 for 1 million approximately, which is really unheard of.
Yeah.
We can't have one orthopedics taking care of 1 million people.
Yeah.
So there is a huge need in manpower for orthopedics, and the same applies to other specialties too. Cardiology, oncology, neurology, urology. The specialty services is not really on the top list of the healthcare priority. You know, and because we only have 3,500 doctors in the country. So there's a huge need for everything. Orthopedics is one of them. And then there's not the infrastructure to really provide first-rate orthopedic care. So in terms of equipment, the diagnostic tools that you need, so all that is one. So that's one of the two reasons why I decided that this is very needed. And then the funding too doesn't exist, you know, for people to even pay for these highly specialized medical services. So those were the three promises upon which I decided that I'm going to come and make a difference, bring people to help, and then hopefully build a hospital that can become a permanent structure for us to provide the service to our citizens.
So, Prof, how are you doing it? I mean, conducting a $100,000 surgery for $10,000. How are you even managing to, you know, scale down the cost in that way?
Yes, so we do it by several means. Definitely, the professional fees here is not the same as America. And also our costs are lower in terms of services that we're providing, but we are also adding or using the same high quality equipment. Okay, so how do we do that? Good question. When it comes to spine, I have designed spine implants, and I get royalties from some of them, and I put all the royalties back to patient care. We get donations from corporate partners, about 20 of them, you know, from all over the world. So when you combine the corporate partnership, the medical device companies that I am acquainted with, who give us the donations, and the ones that I designed for, who also give us good discounts. I've developed implants for Chinese companies, so that makes it possible for us to get donations or purchase at a discount.
Wow.
And then also we have philanthropists who provide us with funds for us to buy some of our equipment, like the MRI machine that we just purchased, and the solar project that we're doing, $1.6 million. This was sponsored, right? So if we get it, and then we have Ghanaians and international partners who are also sponsoring patients. So if we put it all there together, then you can reduce the cost because you don't have to pay back a shareholder.
Right.
You don't have to pay back any dividends. So then we basically are meeting our cost. So the $10,000 was the bare cost that we can use to cover operations, implants, and also make sure that we're paying our professionals quite decently.
That's amazing.
And that's why we're able to do that. It's, now, you have to be ingenious a little bit.
I can imagine. Now, Prof, my little sister is a doctor, and I remember when she was telling me about wanting to go into orthopedics. It was my first time hearing about it as an area of specialty. Her reason, of course, was because she was a Chelsea fan and she wanted to become Chelsea's doctor and massage Frank Lampard. But that's another story for another day.
Okay.
I want to know, who is your typical patient or customer? Is it the sportsmen and women, or who needs orthopedic health care?
Yeah, so orthopedics is a discipline that covers all age groups and all sexes. You can take a baby who is born with, say, a congenital spine deformity. The bones in the spine didn't form well, or the hip is dislocated or dysplastic, or they have club feet. Because newborns, they can develop a club foot. 1 in 1,000 will have club foot. Okay, so even in a newborn, you can have orthopedic conditions: club foot, hip dysplasia, congenital spine deformity. They may have spinal bifida. Okay, so even in a newborn, orthopedics can be a problem. And then as you grow, in your early years, you can develop other orthopedic conditions like bow legs. Right. Okay, your clubfoot may be present. You can develop spine deformity, scoliosis or kyphosis. You may develop a spine infection like tuberculosis. And tuberculosis affects the spine. It collapses it because it destroys the bone. And that can happen at any age. Okay, so tuberculosis can affect the spine at any age and any sex. So your spine can also collapse. And then you can also have an infection in your joints. You know, so we have septic arthritis of the hips, osteomyelitis. And then sickle cell, you know, interestingly, sickle cell also affects the blood supply to the joints of the bones. So you can have a young adult, 20s, 30s, who has their hips and knees destroyed by sickle cell. Okay? And then the trauma comes in, the injuries. And the injury has no predilection for age. It doesn't discriminate. A kid falls and breaks an arm, broken arm. An old man falls and breaks a hip, broken a hip, needs to be fixed. And trauma is probably the most common orthopedic condition that is managed in this country. Poor road network, people are falling, bad workplace environments, people are not lifting correctly, or they're not doing things appropriately.
Or
so
sitting
for all
properly.
ages, you can develop an orthopedic condition of your hip, your shoulder, your back, your knee. And then as you get older, arthritis set in. The joints wear out. And when the joints wear out, you're going to have hip pain and knee pain. And you may need to have it replaced. And that can go all the way up to age 80 and 90 even. In some patients who are that old who come for hip and knee replacements. So, and as you can see, and then we have the sports injuries. So when you take orthopedics, all ages, all sexes, and then there are several categories of orthopedic care. I'm a spine specialist. I'm an orthopedic spine specialist. So I take care of problems with the spine, infection, degeneration, arthritis, and trauma, as well as deformity. Okay. And then, like my son is an orthopedic surgeon, but he only deals with the shoulder, elbow, and hand.
Wow.
You know, in all ages. And that's something I cannot do. It's a whole new specialty in orthopedics. Okay. And that's upper extremity. And then we have orthopedic surgeons whose specialty are hip replacement and joint replacement, like Dr. Ojeda, who's our arthroplasty surgeon. And he does hip and knee replacements in older individuals. And then we have orthopedics who do just foot and ankle. Because there are a lot of foot and ankle problems, bunions, you know, hallux valgus, and club feet, and that's their specialty, and I can't do that. Okay. And then you have orthopedic surgeons who takes care of sports injuries, and that's sports medicine. So sports medicine is another field in orthopedics. So as you can see, even here at FOCOS, our concentration is really in spine, arthroplasty, joint replacement, trauma, and pediatrics. And then occasionally we do some sports medicine, but we don't have all the expertise even here present. So orthopedics is probably the most varied specialty that covers all ages and all sex, and both sexes. It's a huge discipline.
I'm beginning to see that. Now, how do your patients come to you? Do you get referrals from other hospitals? Do you advertise? Yeah, where do they come from?
Yeah, so we advertise, I'm told we cannot advertise medical services in the country, but actually most of our patients are word of mouth. Other patients who have had good experience come here. And then we also have referrals from other hospitals and other physicians. And we get patients from 45 countries. And as we speak, I have a patient from Nepal, one come from Tanzania, a patient from Ethiopia. So FOCOS is really on the map when it comes to orthopedic care. You know, of course, we are internationally acclaimed. We received the Best Medical Tourism Award, Hospital Award for West Africa last year, for instance.
Wow, so people come from around
so they come
the
from
continent.
all over the world, actually. 45 countries that we get patients from.
Yeah.
So it's mostly physician referral, hospital referral, and then patient referrals. And then patients also will Google orthopedic care, and they will see us on the map, and they will call for a referral.
So talk us through the different departments, units, and so forth that you have here at the FOCOS Hospital.
So our services are very varied and wide. We have the outpatient department, where we screen patients initially for orthopedic conditions and then decide what they need, whether surgery or no surgery. And then we have an urgent care where patients can walk in if they have a bruise or an injury or traumatic conditions that we can take care of. And then we have the operative services, which is basically our surgical suites, where we have 2 state-of-the-art surgery suites, state-of-the-art intensive care unit, all the modern orthopedic equipment, diagnostic equipment. If I blindfold you and put you into our surgery center, you would think that you are somewhere in America or UK.
Wow.
So we have the surgery services, and then we have the wards where we take care of patients coming from surgery. We have the acute care ward, and then we have the extended stay facility. And then on the other side, we have all the diagnostic equipment that you need to be able to make a proper diagnosis. So we have plain x-rays, we have fluoroscopy, we have MRI, we have CT scans, and then we also have pulmonary function studies. So we can study all the orthopedic systems, organ systems that involve orthopedic management. And then we also have a laboratory services, which also offers a full complement of all the labs that we need for patients before and after they go to surgery. Hematology, biochemistry, microbiology, parasitology, and analyzers, blood gases. So we're probably one of very, very few hospitals in the country that has a blood gas analyzer. And we could do all that here. So we are supported by diagnostic laboratory. We have perfect dietary and nutritional services. All our patients are fed. All our staff gets lunch from our kitchen.
Wow.
We have laundry services, so we do all our laundry here on site. And then we have an incinerator, so we can actually dispose of our own waste without sending it to another facility or getting dumped somewhere else. So we call ourselves a medical village with a full complement of services, but for orthopedic care. But we also have on staff family medicine specialists, because our children and our adults have other problems. When a patient comes in with an orthopedic condition, they may also have hypertension, they may have diabetes, they may have an oncological problem, and we have doctors who take care of them also. We have neurologists who also runs clinics here periodically. And then we also have a rheumatologist who also runs a rheumatology clinic, because rheumatology is part of orthopedics.
Right.
Rheumatoid arthritis, lupus erythematosus, scleroderma. These are all arthritic conditions that affects the joints and make movement very difficult and painful and sometimes impossible.
Wow. Well, I'll pretend I understood all of those medical terms, but I guess what you're trying to say is that everything orthopedics is catered for here at this facility. That's wonderful.
Yes.
Now, you gave a statistic earlier that alarmed me. You talked about how, at this rate, there are probably one orthopedic specialist to about 1 million Ghanaians.
Yes.
Scary, very scary. I mean,
It
because you can well imagine that a lot of us will need orthopedic care at one point or the other. So what are we doing about it? I mean, you, of course, you're a world-renowned expert. You've taught at Cornell. You have invented technology for this, this specialty around that is used around the world. What are you doing about succession planning? What are you doing to ensure that the next generation of orthopedic specialists might be Ghanaians?
Well, it's a very good question, and that's one of our sustainability agenda, and it's a project that is very dear to my heart, because I'm not going to live forever. Even if I was going to, I would not be capable of doing all the things I'm doing at some point. So when it comes to the manpower development program, as I said earlier, we don't have enough orthopedics. So what we're doing here is to have an environment that we can train future orthopedic surgeons. So since I came back full-time, I have trained 3 other spine surgeons. Most of the surgery is actually done with under my supervision. And in my absence, they can do a lot of the spine surgery. I'll say probably 80 to 90% of it. Wow. So that's good. So if I'm out of the picture, spine surgery can be done. And then we have Dr. Ojedu, who is the joint surgeon, who also has 2 other doctors working with him. And they also getting the training and the experience. What we're trying to do now is, from the Hospital for Special Surgery, where I was a professor, we have a very strong affiliation. And we're trying to get them to help us build a sports medicine center. Now, if we can build a sports medicine center as part of the program, then we can take young surgeons and also train them to become sports medicine surgeons. But as we speak right now, spine surgery can be done, with or without me. And joint arthroplasty, I don't do the arthroplasty. It's another Ghanaian who does that, who's going to train others. So we are doing our part in manpower development and training. We have nurses that also are under our tutelage, who we are training to become orthopedic nurses, guided by excellent director of nursing, and also guided by protocols and policies that are very much what you will see with Joint Commission accreditation hospitals. And then when it comes to the infrastructure, as I said, we have all the resources to deliver orthopedic care. What we're lacking is the funding to be able to take care of everybody who walks through our doors. So now we're okay, but tomorrow we may not be. So what is required really is to build a fund, which I call the endowment fund. And that's the appeal that I'm going to make to everyone, is that everyone should join us to build this endowment fund. Because if we can build an endowment fund of, say, $50, $60 million, then the proceeds can take care of continual training and education programs. It can take care of patients who cannot afford surgery that we can sponsor, even if it's 100 or 200 every year. And it will also help us maintain the operations and keep our resources and infrastructure up to date. So the third answer will be the endowment fund, which will keep us afloat, whilst we are trying to deliver the first two, which is capacity building and infrastructural maintenance.
Wow. It's a great succession planning strategy.
But it's going to need some help. We need a public-private partnership. And we've had very good responses from some of the private entities like GMPC, and others who have helped us a great deal in trying to reach this. But going forward, a campaign will have to be mounted really to build an endowment fund to keep the hospital moving and in perpetuity.
It's amazing. So let's look to the future. I think this is a great way to wrap up. Tell us about the future of FOCOS. Where is it going? What's the big plan? And how does it affect everybody watching today?
So FOCOS, as we know now, is the place to go for orthopedic care in West Africa. And we are well recognized on the continent that patients come from all over Africa to see us. So we want to maintain this brand and this expertise such that when you go to FOCOS, you will know that you will receive the best orthopedic care, and now you're not going to see Professor Boachi. It's just like if you go to the Mayo Clinic, you know you're going to see the best doctors. And that's what we want FOCOS to be. And I believe that it will get there. So first, for us to maintain the brand, to keep it and improve upon it, and also to expand to cover other orthopedic subspecialties, as I said earlier, sports medicine, foot and ankle, hand, upper extremity, orthopedic oncology. These are areas that we need to also expand on, and then build a fund that will keep us going.
I guess that's where the dinner on Saturday comes in.
Yes, it's part of the agenda. It's part of the plan to get our individual to get people to support us by their contributions and donations, so that we can continue to build the fund that I'm talking about, to be able to support patients, sponsor those who can't afford it, and also keep the hospital afloat.
Give us some details about Saturday. I mean, who's invited, what's the theme, and so forth.
So this will be our third annual fundraising dinner in Ghana. The previous ones we had guests of honors that were President Kufuor and Mr. KK Sapon. This year we have Sir Sam Jonah as our special guest of honor. There will be other dignitaries who will also be attending. We usually expect about up to 300 people in attendance. It will be at the Kempinski Hotel. And we hope to be able to raise about 1 million cedis, a modest amount that will help us basically get through some of our early budgetary headaches. And it's going to be a night of fun. There will be music. Becky is going to be there. I will be there. And we're going to bring also to the stage some of our grateful sponsors and patients who have benefited from sponsorship.
Wow.
So it's a time to report to those who have helped us as to what we've been able to achieve with their support, and to thank them for it.
Sounds like a beautiful night, and I wish you all the very best with it and with everything else that you're trying to do here with the FOCOS Hospital. Professor Ohiniba Boakye Eje, what a pleasure. Thank you so much.
Thank you very much, and looking forward to seeing you on Saturday.
I'll be there.
All right, let's party.